Hello, everybody. This is Terry again with the Premom team with Monica, NFP Health Professional, for part 2 on CM tracking, on tracking your cervical mucus. So Monica is going to review a little bit of what we talked about in the last video and then go a little bit deeper with this. Thank you, Monica.
Thank you for inviting me, and very glad to be here with you, Terry, and all the Premom users. Yeah. So I'm going to start sharing the screen just to overview what we saw and review in the first part of cervical mucus. So I just want to bring everything, wrap up everything together, recapitulate what we have seen. So we have here what Premom allowed us to track with their app. So we are focusing in this case in what we see, the observation. So we know that at the beginning, as soon as menstruation has gone, we will have a mucus that is dry or sticky because there's no estrogen present. We'll have what we call a G mucus. Sperm cannot survive in that kind of mucus. The sensation is dry. You don't see anything. Nothing is seen, and could be a discharge like toothpaste. Other characteristic by other cervical mucus methods, they will say that it will be a scan discharge, like I say, toothpaste type. As the estrogen start rising, there will be a change in what we see and what we feel. What we see could be creamy because the G mucus that is infertile is white. It's like a tampon in your cervix because the sperm cannot. So now you produce mucus, it has to move down, and that's the reason that it's kind of creamy. As you see, it's a little white. That is the observation that we have in the Premom app that corresponds to what would be a sensation of damp or moist. You feel different. You feel a change. Other characteristic is that this is stretchy, and this stretchiness is related with a length less than an inch. Not all women have it and don't need to have it. It just could be the sensation as important as the observation. As the estrogens go rising and rising and rising, there will be the observation, it will be watery or raw egg white type mucus. What it would be the sensation is wet and slippery or lubricative. And most of this mucus, the length is more than an inch, like we observe here. And it's hard to break it. It's continually. We call it as well as cervical fluid. As soon as you reach this maximum of mucus, you will hit in 1 or 2 days, or probably the same day, but sometimes it's 1 or 2 days after you have this mucus that you're going to hit the peak with your LH strip in the Premom app. And that is mean that in the next 24 and 36 hours, you're going to ovulate. How we detect with another methods that you're close to the LH peak, because the peak mucus is determined by the last day of a slippery sensation. There will be a dramatic change from wet to dry. And after ovulation occurs, that it can be detected by a rise in temperature using your thermometer, you will change to dry and sticky because you have the type G mucus. And the same, if you're, you can see this scanned discharge as well. So this is kind of what it is, the menstrual cycle, seen and changes in mucus. Okay, we will continue looking at this paper that it was published, which it was showing that women don't produce the same amount of estrogen, and this is related with the same amount of mucus that they can see and they feel. But even though they don't produce as much as the other ones, still there's enough changing of estrogen that ends in a peak mucus to kick the LH to triggers ovulation. So this is cycles. This is a cycle of 30 days. We have 16 days before what it was the ovulation. So this is what it here is 0. So this is the maximum of estrogen that will kick. The LH probably will be here. Ovulation occur, and again, estrogen after will rise again, and that's why we feel sticky again and a little wet, because estrogen stimulates the cervix. There's another cervix responses that can allow us to determine if we are close to ovulation or the LH peak or peak of fertility. So position of the cervix in the vaginal canal, it can be used for women that they wanted to know which phase of the menstrual cycle they are. So follicular phase is what we call pre-ovulatory as well. And luteal phase is what we call after ovulation. So if you see the position of the cervix at the vaginal canal is high as soon as ovulation has occurred. The consistence of the cervix is soft. For example, there's an exercise. When you touch your nose, Terry, touch your nose, it's very hard. That's what we call a firm cervix. And now touch your lips. Touch your lips, how they are soft, isn't it? Nice. That is the cervix when you are close to ovulation. When you're producing that amount of sleepiness mucus, the cervix from this firm converts in this soft. So that's kind of a way to represent. So it is important. As well, the opening of cervical canal, it has to be open so the sperm can enter. So when it's close to ovulation, it's open, and the other time is closed. The vaginal sensation, this is your vagina, how you feel. Always close to ovulation is very, very wet. So here, in this case, it could be variable. Women cannot feel that much difference, but they will feel it, this different, and it will be assured if they have the other kind of sensations and feelings respect to the cervix. Okay?
This is a great book.
Yes, it's very important. Yes, it's very important that because we produce different hormones at different stages of the cervical mucus, this is estrogenic predominance and this is a progesterone predominance. So as soon as ovulation occurs, we start to retain or occurs fluid retention in our hands, feet, and abdomen. Okay? And we feel this tenderness in the breast. Okay? And at the end, we feel a little irritable if we are not pregnant. Okay? Mm-hmm. So these are other signs that can tell us really when we ovulate or we're close at the peak of fertility. This is when we must have intercourse to assure we get pregnant. Okay?
Awesome. But before you go on from there, can you come back for a moment? Mm-hmm. I just want to mention, excuse me, we do now have cervical tracking, cervical position tracking in the Premom app. You ladies asked for it, so we put it in there for you. And also, Monica, can you touch briefly on why your cervix is, as you described, soft, open, high, right? Is that correct for when it's
yes.
At your ovulation
so here,
time?
High, position is high, soft, open, and wet. You will feel the mucus coming out. You will feel it. Why? Because your body's closed or is already releasing the egg, and the egg only lives 12 to 24 hours. So it's kind of a body is telling you, we're ready. We have all the conditions to allow, if you have intercourse and the sperm is there, to really, go and fertilize that egg. And that is the reason. And actually, because everything is soft, women are more prone to engage. It's easy because it's lubricative. So your nature, your body is collaborating to that important moment to co-create a new human being.
Right.
So all the things should be in alliance or be in the way that should be to occur a fertilization. Yeah.
And why is it high? Because I sometimes try to think of like how it would make sense logically for what I'd be looking for. Why is the cervix high during ovulation? I would think it would be low.
Yes, you think that it would be, but
Like, come on in.
Yes, yes, but I think anatomically is the best way to assure that the entrance will be easy for the sperm, because the sperm has to be, the seminal fluid has to be sticky. So it needs to stick at that side. So being open and being high allow that easier. And as the way, because the cribs that I show in the first talk that we have, the cervix, the scripts, like they are producing mucus and mucus. So they are all like packed. Like when you have your, your nose full of mucus, and it's the same. So I think that's what the explanation, but I don't have at hand kind of the mechanism, scientific mechanism or science-based mechanism to explain it. But this is how I understand it. Mm-hmm.
Okay. And how about, you talked about for the cervical mucus tracking using the toilet paper, using how it feels. Do you have any tips for tracking cervical position and how to do it?
Usually what I do is, you have to be careful because you don't want to, because the cervix is open, you don't want to enter infections there. At that time that everything opens, so you have to be very careful that you are clean, your hands and everything. But usually this is the longest finger, so this is the easiest to use, and if you open and you are kind of sitting, like in this position in yoga, with your bearing down in some way, you will help easily to access, and you will see your nose. It will be like touching your nose.
Okay.
Yeah, like that. You will feel it immediately. You will feel that something is there. Okay. Yes. Yeah. So the best is like how the native indigenous people used to delivery. They used to go to the river, they opened their legs and their knees, and they were putting in the water the baby. So that's the same way that you will enter your finger and you will touch your cervix. That is the head of your uterus. Yeah, because the indigenous, they didn't have taps. They didn't have taps with water. They didn't have these gynecological chairs, and these speculoos to open everything. So they used to go to the river when they were ready. The way that the river was very shallow and very calm. And they start pushing them, and the baby will go out, and they will take in the baby. Yeah.
Neat. Thank you.
Yes. So that will be the best way, but very, very careful not to introduce infection, because our hands are dirty, and at that time when the cervix is in that position ready for conception, it is easier to get infections as well. Yes. I would like to share about the arousal fluid, that it could be difficult to see the cervical mucus. So arousal fluid is defined as a response to physical and mental stimulation. Obviously, it provides lubrication, dissipates very quickly. It's almost like water, like a membrane, like a film, and it can disappear in less than an hour. So you really know that if you aren't in foreplay kind of stage and you have this, that is arousal fluid, because mucus, cervical mucus, every day you will have a little more. Arousal fluid is just related with this foreplay. How we produce this arousal fluid? So this is our vagina. This is again our cervix. Here you see the crypts that I before showed you at the beginning of the presentation. And this is our vagina. And we have these glands here. We have the other one here. They are the ones which produce this type of fluid. It's not a mucus. Mucus has a stretchy kind of characteristic because it has a protein mucin that allows to be stretchy. Fluid is fluid. It's like a film. I would like to mention about the seminal fluid. So seminal fluid is a discharge of semen from men during intercourse. How a woman can get kind of rid of the rest of the components of the semen, because the semen is formed by the spermatozoids that are the cells that are going to fertilize the egg, and the rest, there are other things. There are fructose for them to move, and it has this sticky kind of proteins, so it's stick at the cervix. Yes, so they can move into the crypts and start moving into the mucus if there's appropriate mucus. If not, they cannot move with the G mucus. So we recommend that women urinate within 1 hour after intercourse, so you can remove the excess of the semen. 20 minutes after is deposited at the entrance of the cervix, it will liquefy. It will convert into a fluid, like a liquid. So we can remove it by within 1 hour. What else? We recommend the Kegels exercises and bearing down. Kegels exercises are really good for women because it allows and activates all your pelvic muscles. And some women actually can allow the mucus that is up going down. The same with the semen. And you can wipe until seminal fluid is gone, so you can know that it's not going to mix with your mucus that you're producing. And semen is normally thick, sticky, and clumpy at the beginning when it's released, and later liquefies after 20 minutes in a similar consistency as the cervical mucus. So that's the reason that we need to track that. Okay?
Great. That was one of my questions, because you had mentioned
Sure.
that the semen will be around for an hour or less, and I was wondering, like, how do you track that? So then you explained here how you can make sure you clear your body of the semen the seminal fluid before you start tracking cervical mucus again.
It will really help you, because the sperm, if you have cervical mucus, it will absorb the sperm, and the sperm starts swimming and being in the crypts and there. Yes.
Great. So let's talk about different types of lubricants.
Okay, so about vaginal lubricants are very important, only in cases that women are reporting of vaginal dryness. I just found this reference very important in 2019, that they study the different lubricants, vaginal lubricants for couples trying to conceive, that health professionals were recommended. So they found that 10% of couples that are trying to conceive, they report that there's a vaginal dryness, that discomfort during intercourse. So if you need to use a vaginal lubricant, first you need to know that it shouldn't be toxic. Not all vaginal lubricants that are over the counter and some doctors recommend are really the ones that you need. What you need to find is that they should be at pH 7. They shouldn't be non-toxic, not have fragrance or accents or things like that, like different smells. And the other thing, it should be similar to what is the seminal fluid, similar to water. So the best is vaginal lubricants that are not affecting the sperm function. What you need to know, that the motility, the progressive motility and vitalities are kept during the using of these vaginal lubricants. Some of them are generally known as lube, and they need to be approved by the FDA by a specific category. So you need to know that it says approved by FDA under the category PEV. PEV means that gamete, fertilization, and embryo are compatible, so they don't destroy the sperm mobility and the fertilization process. Some of the ones that we're studying in this paper are Conceive Plus, Precede, and Prevaginal. I looked at Conceive Plus and Precede are available in the United States. Prevaginal is not available. I couldn't find it. It's more in Europe, but they are approved by the FDA. And there's another ones that not necessary are the best for couples to try to achieve pregnancy. One is called Aquagel, that is approved by the National Health Institute, but in this study show that affect progressive motility of the sperm. The KJ gel is detrimental for sperm mobility. There's one that it has a very high customer satisfaction because it has a really good smell. It says that uses like a raspberry kind of a scent, but I couldn't find any studies published that prove that it's safe for trying to conceive. It's called Baby Dance Fertility Lubricant. That's what I have. There's something else that women that want to develop this awareness to see the mucus because they don't see it. There's are these guaifenesin compounds called regularly as Mucinex that they thinning the mucus so women can see it. It doesn't mean that seeing the mucus with using these guaifenesin compounds, you're going to get pregnant. The only thing that is going to help you is to have this awareness of the mucus. So we recommend that close to that LH peak that you already know from your previous cycles, you take it 2 days before, just 1 spoon of the guaifenesin. Make sure the Mucinex is only guaifenesin, that there's not any other compound included. That's another way to see the mucus. Other kind of questions that I have heard is that if I don't see mucus, can I get pregnant? Yes, if you don't see mucus, you can get pregnant. If you have an LH peak, it means that you can get pregnant because estrogen has triggered the LH if you have regular cycles. So it's easy if you see the mucus, but don't discourage if you don't see it. Just keep trying to develop this fertility awareness, this sensation, and seeing the mucus.
Mm-hmm. So if they're seeing the LH peak, but they're not seeing the cervical mucus, then it's still okay.
It is still okay. Yes, yes. There's as I say, they can use the guaifenesin just to see if the mucus is present 2 days before. They can do the Kegels exercise to let this come in, bearing down, because by gravity, the mucus will come. That's the reason that this fertility awareness is developed throughout the day and before you go to bed. Because during the night, you are in this position and the mucus is just lying here in the cervix. So they need time to come out all the length of your vagina to feel it in your vulva. So it takes time. You have to help the gravity allow you that the mucus come down. That's the reason that is an activity that you develop every day. Every time that you go to the bathroom, say, what I see, what I feel. Sometimes menstruation, we know when menstruation comes because you just feel that something come out, isn't it? You just stand up. It's the same with mucus. It's the same fertility. It's the same awareness. So if we can do it for our menstrual fluid, we know how heavy is our menstrual fluid by that. So we have to develop the same for the mucus and the sensation. When we have menstruation, we know that we're wet. There's no doubt about it. So it's the same. It's just to develop, but it takes time. That's the reason that when we see women that want to develop just fertility awareness, it takes 3 months to complete it before you really feel that you get it.
Okay. I had just a couple ending questions for you. Let's
Sure.
stop the screen share.
Okay, sure. Thank you.
Are there any black or type of cervical mucus where someone might want to consult with a fertility consultant?
Yeah, if you have everyday kind of a mucus that is smelly, that is kind of yellow, that you are itchy, that is white all the time and you have itchy kind of things, it's better to check that it could be related with an infection. So it is important to do that. Remember, fertility is related with a changing developing pattern. And if you develop this awareness, you will know what is normal for you now. And when you see a change in this mucus, you know something is wrong. And that's the reason that you can approach your doctor and say, you know, something is not right. This is not what I always have. And that's as well a way to protect the reproductive health of women, even if you're not trying to conceive, you know, just to know that you're in the right way with your reproductive health. Yeah.
Would that go the same with the opposite way where you're normally have a lot of cervical mucus and then suddenly you're pretty dry? Would that also be something to bring up to your specialist?
Well, if you are very wet and you know that it's related with your LH peak or your peak mucus, and as soon as you change it to dry, and you will have your menstruation 11 to 17 days, if you're not trying to conceive, it's normal. Yes?
What if you have like a whole cycle though, where you're usually...
Yes, no. If you have a whole cycle that you're totally dry, something is wrong. It's what we call anovulatory cycles. The estrogen, maybe you have a patch of mucus, but you didn't have an LH peak, and later was dry. So it means like every day is almost the same. That's not what you expect. We say women cycling because we are always in a cycle. We are always moving. We're always in phases. Infertile, fertile, fertile, infertiles, always in phases. And that's what women, when we are in our years of reproduction, is a change. Always, even we have this, you know, every 20 days I have to have these pads. But during those 20 days, there's changes because we have 4 hormones. We have the estrogen that are related with the production of mucus. We have LH that is related with the trigger of the ovulation, the release of the egg, and later we'll have progesterone. And who starts first is the FSH that we only measure in women when we're close to menopause. That's only the time. Yeah.
Thank you. Do you have any final thoughts on cervical mucus that you want to leave our...
Yes, I think I want to encourage our Premom users that it is something, it's a gift that we have to understand our fertility, even we're trying to conceive or not trying to conceive. But if you want to increase your chances to really know when you're timing and in helping you to feel less stressful about everything, fertility awareness is something that we need to learn as women, something that is just for us. And we have so many tools to do it. The LH strips is helping us. If you get it, you should be, you know, pretty sure that you produce estrogen. Yeah.
I like how you kind of described it as it could be easy to start paying attention to what you're noticing. That it doesn't have to be a complicated tracking process.
Yes, it's just how you feel and what you see. And even when we teach natural family planning with couples, we always engage men, and the women really like, because men has to ask them, how you feel today? Well, I feel dry, I feel wet. So it's kind of way, because women, you know, our brains are wired. So everything is connected. Men, they have like compartments. Everything is separated. They have a box for resting. They have a box for money. They have a box for work. We have everything together. So That's how we are, because we have 4 hormones in 1 month. They only have one, the testosterone. They, from puberty to always. So it is important for us to understand our emotions and our awareness of fertility. Yeah, for fertility. Yeah.
Wonderful. Well, thank you so much, Monica. That was very enlightening, and I hope everyone starts to pay more attention to this very valuable tool, and that we all continue on our journeys. Good luck to us all, and we hope to have you again soon, Monica. Thank you.
Thank you so much for inviting me. Bye-bye, Terry.